Hello, my name is Simon Pickering and I'm one of the orthopaedic surgeons working in the Department of Trauma and Orthopaedics here at the Royal Derby Hospital. We have produced this DVD to give you some extra information about your forthcoming knee replacement surgery, although it is very important that you read the information leaflets that you will already have been given. We hope to show you what to expect by introducing you to the key members of the team who will be involved with your treatment at its different stages. Pre-op area. You will be asked to attend the preoperative assessment unit. Some patients, but not all, will see an anaesthetist and a surgeon, although all patients will be seen by the specialist nurses working in the department. Some patients will be seen by an occupational therapist to assess what equipment and help might be required at home after your surgery. Pre-Habilitation Class. Some patients, but not all, will be seen on a separate visit in the Pre-Habilitation Class.
The purpose of today is to allow you to meet some of the staff that will be involved in your care when you've had your total knee operation. Ask any questions that you might already have about the surgery. And from a physiotherapy perspective, it's a great opportunity to be able to show you some of the exercises that you will need to be doing after the surgery, because it would be good preparation for you to be starting some of those already at home. We'd also like to take the chance to show you how to walk with some crutches, because it's usual for a period of about 6 weeks after the operation to need a walking aid. And we could also show you how to do the stairs with those crutches. Okay.
Admissions area.
Good morning, John Smith.
You will come to an admission area on the day of your operation, where you will be greeted and readied for surgery by a member of the nursing staff.
On arrival to the ward, you will be welcomed by either the receptionist or one of the nursing staff. They will ask that you confirm your name, address and date of birth. You will be asked to confirm these by nearly every new person that meets you, and this forms part of the necessary safety check to ensure that the right patient receives the right treatment. You will be shown to an allocated bed area where one of the nursing staff will record your temperature and blood pressure and obtain any necessary blood samples. You must report if there have been any changes to your health since you attended pre-admission clinic. The nurse will then perform all essential pre-surgery checks.
I'll leave you to get changed then, John. If you need any assistance, just give us a shout. We'll be more than happy to help.
Morning, sir. You will also be seen by a member of the surgical team and your anaesthetist. Surgery, are there any last questions that you wanted to ask?
Not at the moment.
No. Good. Could you stand up for me, please, sir?
Certainly.
Thank you. Perfect. And sit down.
Okay.
Good. I'll see you later on, sir.
That's okay, thank you.
Bye-bye now.
Bye-bye.
Hello, sir.
Hello.
My name's Craig Morris, one of the consultant anaesthetists here at the hospital. Just come to have a quick chat with you about your anaesthetic today. For what operation are you here for?
Knee replacement.
And it's the left leg. Yeah, that's fine. Okay, that'll be checked a few times before we see you down in theatre.
Theatre department. When it is time for your operation, a porter will take you on a trolley to the operating department. The receiving nurse will check all your details with you again, and you will then be taken through to the anaesthetic room. You will then be wheeled into the operating theatre, where the surgeon and theatre nurse will be waiting for you. Many patients will have a spinal anaesthetic, where you are awake throughout the surgery, but unable to feel anything at all. If you wish, however, you can choose to have some sedation throughout the procedure, so that you are not aware of the operation taking place. Before the operation starts, a large screen will be put in place, and the staff will work behind this for sterility reasons. When the surgery is over, you will be taken into the surgical recovery ward. Theatre recovery. You will stay in the theatre recovery area for a little while to make sure that you are recovering from the anaesthetic and the surgery. Extended recovery and ward areas. Morning, sir. How are you?
Very well, thank you.
Nice to see you again.
Yes.
Things all went very well the other day, and the nurses are very happy with the progress you're making, as are the physiotherapists. It's very important you get your knee moving, as you know, and they're very happy that you started to do those exercises. I thought you might like to see the x-ray of your new knee replacement. So look, here you go. There's a picture of the knee from the front and from the side, and I'm very pleased with that. It's all looking very good.
Good.
So really all I need from you now is to work very hard with the physiotherapist, and we can get you home as soon as we can.
Oh, good. Excellent.
Perfect. All right, see you later. Bye-bye now.
Thank you.
Good morning, John.
Hello.
Hello, how are you?
What's the matter, then?
After your operation, your first day will be spent in the recovery ward. Here, the nurses will closely monitor your observations and ensure you have adequate pain relief.
So put the hands at the side of you on the side of the bed. Putting all your weight through your gut.
Early mobilisation is of the utmost importance following surgery to facilitate you getting the most out of your new knee.
Just slide that leg back a little bit.
Additionally, early mobilisation has been shown to reduce the risks of both chest infections and thrombosis. The nursing staff will get you out of bed and reinforce the exercises given to you by the physiotherapist. Exercising your new knee will not be pain-free, but it is crucial that you build upon the previous day's achievements.
Very good. If you can just hold it there.
Over the next few days, as you recover, the nurses will continue to monitor your observations and pain relief, encourage your straight and bent leg exercises, and provide you with wound care.
You feel the chair hitting the back of your legs.
So what I need you to do is keep your knee as flat as you've got it there. But pull the
Physiotherapy
foot
is
up
essential to
and down
maximise your recovery following a total knee
That's
replacement.
the start position.
Physiotherapists
What we're
will
gonna do is
work
keep
with
your knee
you
as
on
flat as you
exercises
can.
to
See if
regain
you can
both
lift
your
the
knee
legs
movement
literally
and
off the
strength.
bed.
They will ensure you're able to walk
Let's feel
safely
it.
with
Knee
your
is
walking
awesome.
aid.
But once you've lifted it once, usually you don't look
Once
back.
admitted,
Okay,
the
it's just a
physiotherapists
bit
visit the day
sore.
after surgery through to
If you can have a go and
discharge.
see if you can tap my hand
They
up
set
there.
individual exercises for you
Oh, well
and
done.
supervise the progression of your
Brilliant. Now
walking.
relax again.
A physiotherapist
John, a
from the
physiotherapist will
hospital
be back to
may
see
visit you
every
at
day.
home to check on your
In the
progress,
meantime, if you could
and
carry
you
on
will
doing
then
those
continue your
exercises,
physiotherapy
as I said,
as an
at least 2 to 3
outpatient.
times on your own, and then we'll review how you're progressing in the morning. Okay.
Right.
Thank you very much.
Thank you.
After you get home,
So, exercises you was taught in hospital. Just wanna
once
have a
you
look
are
how
at
you're
home,
going through them.
you should continue the exercises
So if
that
just
you will
do
have
the
been
bending
shown
one,
by
one side backwards
physiotherapy.
and forwards.
A vital part of recovering from a knee replacement is getting
Nice
back
and
the
easy, do
movement in
about
your new
4,
joint.
nice and easy.
This can be very hard work, and in many cases, further outpatient physiotherapy sessions will have been arranged. You may also be telephoned or visited by one of the orthopaedic outreach nurses to check on your progress. You will return to the hospital at 6 to 8 weeks for your follow-up appointment.
And then bring it forward.
Outpatients. You will come to outpatients to see the consultant or one of their team, and in some cases, you may be seen by an arthroplasty practitioner, someone whose special practice is with knee replacement patients.
When you attend for your first outpatient appointment, we will check your knee scar, measure how well your knee is moving, and make sure that you are returning to the activities you need to be able to do in everyday life. Sometimes it can be very useful to write down any questions which you may have, and we will try our very best to answer them. How are you getting on then?
All right. Good. Good.
Thank you for watching this DVD, and I hope that you found it helpful. Could I please ask you to return the DVD to the nursing staff on the ward on the day of your admission, so that we may use it again. May I wish you well for your upcoming surgery, and may I also encourage you to contact any member of the team if you have any concerns or unanswered questions. They'll be more than happy to help.